Hello, and welcome to From the EBPL Archives, Encore presentations from the East Brunswick Public Library. I am your host, Melissa Hosick. This event was presented as part of our Just for the Health of It initiative. Just for the Health of It is a proprietary health literacy program developed by the East Brunswick Public Library to promote health literacy in Middlesex County. To learn more, visit justforthehealthofit.org. Now, enjoy the program.
Okay, so welcome and thank you for joining us this afternoon for What You Need to Know, Health Insurance Open Enrollment in New Jersey. My name is Kathy Churn and I am a consumer health librarian at East Brunswick Public Library. Today's program is brought to you by the Family Resource Network and the library's Just for the Health of It initiative to promote community health and wellness. Today's speaker is Renata Svincicka, M.P.A, Community Health Manager at the Family Resource Network, and Yamilet Zagara, MHA, Bilingual Navigator / Resource Coordinator at the Family Resource Network. Please be aware that this talk is being recorded. Please keep your microphones muted, and the recording will be available at ebpl.org/YouTube. It will also be emailed to the registrants. If you have any questions, please type them into the chat box, and the speakers will answer questions at the end of the talk. Without further ado, I'll turn things over to Renata.
Thank you so much, Catherine, for the introduction. Good afternoon, everyone. I hope everyone is staying safe and healthy. Today, I will be talking to you about health insurance in New Jersey. So I am not going to delay it any further, and I'm just going to get straight to it. So I guess I will start by telling you that New Jersey now has its own marketplace. This is completely new. Previously, New Jersey had or was under the federal marketplace, which is also known as the Affordable Care Act. The website was www.healthcare.gov. Now New Jersey decided to create its own marketplace so that it doesn't depend on the federal mandates, just in case that anything happens with the federal marketplace. And so now we're all able to find our own affordable quality healthcare on its own website, which is Get Covered New Jersey. And so you can find essential ACA health benefits, browse plan that are available on the marketplace. You can compare costs and benefits and see what you qualify for. You can do all of that on the website. So as previously, during previous open enrollment seasons, the enrollment began on November 1st, and historically, it would always last until December 15th, so that coverage starts on January 1st. However, New Jersey this year decided to extend the open enrollment period until January 31st. And so now residents of New Jersey do have the flexibility. For example, if somebody enrolls on December 31st, their insurance policy will start on January 1st. There will not be delays with the start of the new health insurance plan. And so with that, if you sign up in December, your policy starts in January. And if you sign up in January, your policy will start in February. And so I've been talking about open enrollment, so we'll explain a little bit about that. During this season, open enrollment, anybody can visit the marketplace and can choose and pick their plan, sign up, make changes, really do anything that they would like in relation to health insurance. And then when the open enrollment period ends, residents are only able to sign up for health insurance or make changes if they have a qualifying life event. And so that would be special enrollment period. And to qualify for special enrollment period outside of the open enrollment, you do have to have a special event in your life. So that would be either getting married or moving, getting a new job, a change of income, having or adopting a baby. All of that would qualify you to sign up for health insurance throughout the year. So who can use the marketplace? It can be any primary New Jersey resident, but also somebody who lives anywhere in the United States, but fills out taxes because they work in New Jersey. And it has to be a U.S. citizen or a lawfully present resident. And this person cannot be incarcerated. So in order to apply, you do need the following information. Whether you're applying yourself or you are using the help of an assister, such as our organization, you do need to prepare the following information ahead of time, just to ensure that you can fill out all of the sections, because you wouldn't be able to see the plans if you miss any of the sections. And so the information that you need is your home and mailing address, birth dates for anybody on the application. So whether you're just applying for yourself, or it's you and your spouse, or you and your dependents, your children, you do have to have birth dates for all of the people on the application. Social security numbers on all of the people on the application, documentation for legal immigrants, if applicable, employer and income information. And what's important to know is that the marketplace does look for projected income. So for example, if you apply now for 2021 coverage, you will have to calculate your projected income. So you would not be looking at the past year, at your tax returns, you will be looking ahead. So you will have to calculate your projected income and policy numbers if you have any current health plans at this time. So the marketplace, it provides a comparison tool, and it can show you information or plans perhaps with very basic information. So all you need to fill out is your zip code, your age, and your income, again, projected income, your family size. And based on this information, the plan comparison tool should be able to give you a pretty accurate estimate on what you're eligible for. And so you can also access the monthly premium amount, covered doctors, and yearly total cost for any specific plan. And you can see if you qualify for any financial assistance if you're eligible. So speaking of financial assistance, there are several types of assistance available on the marketplace. So the first one is premium tax credit. And this tax credit will help you lower your premium payments. Cost sharing reductions will help you lower your out-of-pocket costs, such as deductibles or copays. And then there's a brand new saving option. It's called New Jersey Health Plan Savings. And it never existed before, but now that New Jersey has its own marketplace, they rolled out this New Jersey Health Plan Savings. And so this will help you get additional help for people using the marketplace. And based on income, if you fall under a certain threshold, you may qualify for NJ Family Care, which is commonly known as Medicaid. It is publicly funded by the state, and this insurance will be either free or low cost. Like I mentioned before, the qualification is based on income, and the qualification chart is actually available on the NG Family Care website. But if you have any specific questions, or if you need to access this chart to see if you may qualify, you can ask a question at the end during the Q&A, and I will be able to answer. Or you can also reach out to us privately after this presentation. We'll be happy to explain the qualification for NG Family Care. So again, you can just go on the Get Covered New Jersey marketplace. You can fill out the application, and if it happens that you do qualify for NG Family Care, your application will automatically be transferred to them, and they will be in touch with you to, if you need to submit any additional application or any additional information, or if you need to prove your income, then they will be in touch with you. But what I'm trying to explain is that once you fill out your application on NG Family Care and you may on the marketplace and you may qualify for NG Family Care, you do not need to fill out 2 applications. Your application from Get Covered New Jersey will automatically be transferred to the New Jersey Family Care website. So what is great about financial assistance on the marketplace is that 8 out of 10 people or users perhaps on the marketplace, they do get a tax credit that helps them pay for their plans. In 2019, 8 out of 10 people were able to take advantage of a tax credit. And the average savings is $366, and that's using the tax credits. So if you need assistance with Get Covered New Jersey, you can call the customer service line, or you can find local assisters such as our organization. We are funded by the state. We have a grant from the state of New Jersey to run this program. The services are free to consumers, so you do not need to pay to access our services. And we can help you fill out your application. We can make changes on your behalf, answer questions that you may have related to your plan. We can help you read your explanation of benefits, find doctors that participate with your plan, see if your medication is covered, talk about your copay, deductibles, really anything that's related to health insurance. Excuse me, to health insurance, we can help you with that. And we are certified, so all of our navigators, they go through pretty rigorous training that is done at the end of the summer prior to open enrollment. We recertify every year, just in case there are any changes, such as this year, we had to learn about the new marketplace. So they put out training for us to complete, and we get a certificate. So also wanted to give you a tip that if you do seek assistance, please ask for a certification of the person that you're speaking to make sure that they really are certified to help you. So now I'd like to give you some frequently asked questions that we commonly get. So what if I have a pre-existing condition? So the great thing about the marketplace is that insurance companies, that is, cannot deny you coverage or treatment or increase your cost if you have a pre-existing condition. That is a federal law, and New Jersey follows it. So, whatever pre-existing condition you may have, this will not affect the cost of your health insurance plan. it will not affect your coverage in any way. And what if I don't agree with my chosen plan? You can file complaints through the New Jersey Department of Banking and Insurance over the phone or online. So New Jersey Department of Banking and Insurance oversees the marketplace. Therefore, you will be filing the complaints with that department. And again, navigators are able to assist you with filing an appeal or making any changes. And that's really all I had as far as the information that pretty much covers the marketplace. I think I got everything. So I was speaking rather fast. I do realize that. So if you would like to ask any questions now, if you would like me to go back to any of the sections that I covered, please ask me and I will be glad to do that. So now open the floor to our participants to ask any questions that you may have. Unfortunately, you cannot. So there is a question on the application. If you go on the marketplace, it will ask you if your employer offers insurance and you do qualify for it because you work full-time, and you select yes, then you would not be able to proceed with the application, because if you are full-time and your employer offers insurance, you know, I do realize that it may not meet your needs. However, they will not, the marketplace will not offer you any insurance plans because your employer provides it. Yes. Yep. So again, thank you so much for mentioning this. I actually should include this in my presentation. So previously, this was all across the country. On the federal level, everybody had to pay a penalty if they don't have health insurance. And then the federal marketplace removed it, but New Jersey still follows it. So if a New Jersey resident does not have insurance throughout the year, they will not pay a federal fine, but there will still be a New Jersey fine. And that is calculated when you file your taxes. So for example, if you did not have health insurance in 2020 and you file your taxes for 2020, your accountant will calculate how much that fine will be. And again, that's based on income. So that is actually a glitch on their website. We have noticed, we were actually just speaking among ourselves, the navigators, the other day, because one of our navigators, they noticed it too, because they were assisting somebody. They saw that there were some marketplace, not marketplace plans. We contacted customer service and they did confirm that it's a glitch on the website. And that only appears if you're using the window shopping tool. If you actually create an account and you go in and fill out the entire application, you're going to see the exact same plans, but it doesn't show marketplace, non-marketplace. So I believe they're working on it to remove that, because it is confusing people. But you should really not be paying attention to that, if that makes sense. Yeah, you can absolutely save it and come back to it. Like if you need to get additional information, or if you just don't want to, because it does take some time to fill it out. So if you would like to complete it at a later time, you can just save it, come back to it. Yep, yeah. At the end of the application, it will tell you right away how much of a financial assistance assistance you qualify for. And then you're able to view the plans immediately based on your financial assistance, or like it will tell you how much each plan will cost you right away as you fill it out. Yes, yeah, you do have to fill out the application. Although the application is saved in the system, and for example, you do not have any changes in your income, your address is still the same, everything is still the same, you still have to go back to the application, confirm that the information is still correct, still current, and it will reapply for next year. Whether you're changing the plan or keeping the same one that you have, you still have to go back and make that selection. And I do realize that you probably filled out your application on healthcare.gov last year. So now you will be using the New Jersey Get Covered website this year to reapply. And so when you go on the Get Covered New Jersey website, you do not need to create a new account. It is automatically transferred from the federal marketplace. And so you should be receiving an access code either in the mail or by email. But if you didn't receive it, you can contact one of our sisters and we will be able to help you locate the access code. Yes, yep. All of your files have been transferred to this new website, the state-based marketplace. And so you will be using that website going forward. Even if you go to the healthcare.gov, the federal marketplace, it will just automatically transfer you to the New Jersey-based website. So if you don't have any changes in your income, if it's relatively the same, and there haven't been like changes in your family, like based on your taxes, then it should most likely be the same, the price, if you're keeping the same plan. There might be a slight difference, but it shouldn't be a significant amount. But if all of your information is still the same, for your eligibility purposes, your plan should most likely cost the same price. Also, I failed to mention something important about Angie Family Care, and thank you for bringing this up. Due to COVID, anybody who is currently eligible for New Jersey Family Care or were eligible throughout 2020, and it's time for them to renew their application. New Jersey suspended renewals, so you're automatically re-enrolled for next year for Angie Family Care. That's the reason why you didn't receive anything in the mail, is because due to COVID, they do realize that people, basically what I'm trying to say is that you do not need to go on the website, you do not need to do anything. Whenever they will need information from you, they will send you a letter. Right now, until further notice, they don't have the end date for this. Like, even if you call your local Board of Social Services office and you try to reach the Medicaid office, they will tell you that the automated message will tell you that they're not renewing applications. You're automatically re-enrolled until further notice. And whenever they make the decision to start renewing or reviewing applications again, they will let you know. And I do see that there were some questions posted in the chat box, so I'll address those. So the first one is, right now I'm unemployed and got insurance on the marketplace. I will be turning 65 on June 30th. How do I go forward? So you will be moved to Medicare once you turn 65. I believe they contact people that are about to turn 65 3 months prior. They will send you a letter to let you know that, reminding you you're about to turn 65. And they will send instructions on how you can apply for Medicare. Again, if you have any questions or if you need any guidance on that, transferring from the marketplace to Medicare, you can contact one of our navigators. We'll be happy to help you with that. So somebody is asking me to provide contact information, so that has been posted in the chat box. Also, my colleague Yamilet Zagara, she is also on this call, on this webinar. So she posted additional information that we are bilingual navigators as well. So I myself speak Russian and English, Yamilet speaks Spanish and English. Our colleague Greta speaks Lithuanian and English, and then we have some additional navigators that speak English only. And so, we can help you in other languages as well. So you'll find that information in the chat box. Somebody's asking a question. If I move out of state or start a job that offer insurance, am I able to cancel my plan at any time? Yes, you can cancel your plan at any time. And you really don't need a valid reason to cancel. Even if you move out of state or get a new job, you just decide that you no longer want to have health insurance. I'm not promoting that, but if you do find yourself in that situation, you can cancel your plan. But just wanted to let you know that you do either have to have a special event in your life in order to re-enroll, or you have to wait for the next open enrollment period to re-enroll. And if you don't have insurance throughout the year, like I mentioned in my presentation, you will have to pay a fine because you didn't have coverage. Somebody's asking if Medishare is in compliance with the New Jersey mandate to have medical insurance. Actually not sure what Medishare is. Looks like it's Christian Medical Sharing Plan. I'm quickly Googling this. So this is not a marketplace plan. I've never seen it on the marketplace. So that should not be, well, it may be in compliance in terms of coverage. It may be similar to a marketplace plan. However, if you go with that plan, you can also purchase plans outside of the marketplace. But the beauty of the marketplace is that if you have a certain income, you may qualify for savings, for tax credits and the New Jersey help credits. So you can take advantage of those. But if you go with Medishare plan or any other plan outside of the marketplace, you will not be able to take advantage of the tax credits. I hope this answers the question. Right, so I think that's all the questions in the chat. So if anybody else would like to ask, please unmute yourself and you can ask me your questions. It seems quiet. I'll give it 2 more minutes. If you would like to either post your question in the chat box or unmute yourself to ask me, I'll give it additional 2 minutes. But overall, this concludes my presentation for today. Thank you again to the East Brunswick Public Library for inviting us to present to your community. We're always happy to share the information, and please refer to the contact information in the chat box to send us an email or call us to ask any questions that you may have. Maybe you want to speak about your specific situation, if you're currently enrolled or you would like to enroll in a marketplace plan. We'll be happy to sit down with you. Oh, and also wanted to mention something important is that all of our navigators are providing virtual assistance only. Again, due to COVID, we would like to keep our staff and our consumers safe. So we are meeting virtually. There are no in-person assistants at this time. So we will be able to assist you over the phone, via Zoom or Skype, FaceTime. We use it all. We try to be as accommodating as possible when it comes to technology and the way you want to reach out to us. So we'll, work that out with you. And we also provide evening and weekend hours as well. So feel free to reach out to us. All right. Well, again, thank you so much for having me today for this presentation. Had a great time answering the questions and sharing the information about the state-based marketplace. Again, please reach out to us if you need any assistance, if you have any questions, or if you know anybody that may need assistance. We're here to help you. The program runs throughout the year, so even outside of open enrollment, our navigators are able to assist with your applications. May you need any help.
Okay, so thank you, Renata, for presenting, and also thank you for Yamilet for providing the information in the chat box, and also for answering all our questions. And thank you everyone for joining us for today's talk. And the recording will be sent out to everyone who's registered, along with ways to contact our speakers and also ways to get assistance. Okay, so everyone take care and stay safe.
Thank you. Bye-bye.
Thank you for joining us for this week's Encore presentation. To join us for live programs or to learn more about the East Brunswick Public Library, visit our website at ebpl.org.